5 health checkups you should skip after 70 that might do more harm than good. There's a hidden truth most seniors never hear from their doctors. Every year, millions of older adults line up for medical checkups, thinking they're staying safe. But what if I told you that some of those very tests, the regular ones your doctor insists you need, could actually push you closer to surgery, stroke, or even cancer? Recent studies show that nearly 37% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. And shockingly, 99% of people over 70 have no clue they're being over-tested. One of these tests, number 1 on our list, is responsible for about 5% of all cancer cases in the US, roughly the same number caused by drinking alcohol every day. You won't hear this from your clinic. You won't see it on a billboard. But the truth is buried deep in the science, and today, we're bringing it to light. In this video, the 5 health checkups you should avoid after 70, and the chilling truth about what they can actually do to your body, all backed by real science. And you won't believe what ended up at number 2. Before we get started, tell us in the comments below where you're watching from, your age, and whether you've ever regretted a medical test or procedure. Do you think seniors are tested too often? We're reading and replying to every comment with personalized tips and insights. And don't forget to like this video and subscribe to our channel for more videos just like this. Now, without further delay, let's talk about the first test, why it seems harmless but could quietly destroy your quality of life.
Number 5. The bone density scan. It sounds harmless enough. A quick scan, no pain, no needles, and you walk out knowing if your bones are at risk for fractures. But here's what almost no one tells you. After the age of 70, a bone density scan can often cause more worry than benefit. This scan, officially known as a DEXA scan, measures how strong your bones are. It's mainly used to detect osteoporosis. But in older adults, especially women, the results almost always come back showing lower density even when there's no real danger. That's because bone loss is simply a normal part of aging. Just like wrinkles or gray hair, it happens to everyone. Yet, countless seniors are pressured into taking medications like bisphosphonates, which are meant to strengthen bones but come with serious side effects, including jaw necrosis, a rare condition where part of the jawbone begins to die, and painful esophageal irritation. Now here's the issue. Research shows that treating mild bone loss in people over 70 with these drugs has little to no effect on actual fracture risk. One study, published in the Journal of the American Geriatric Society, tracked over 1,200 women over 70 and found that bisphosphonates lowered fracture risk by only 0.3% after 5 years. That's something, but it's far from life-changing. Instead, many of those women experienced medication side effects, things like digestive problems, inflammation in the esophagus, and even brittle bones that snapped in unusual ways. Take Rose, a 76-year-old retired piano teacher. She was sent for a DEXA scan after her routine checkup. She'd never fallen, had no pain, and took daily walks. Her scan showed osteopenia, a mild reduction in bone density that isn't considered osteoporosis. Her doctor immediately prescribed alendronate, a bisphosphonate. Within just 3 months, Rose developed severe acid reflux and intense jaw pain. By the time we saw her, Rose hadn't played piano in weeks. We took her off the medications and started her on a program of vitamin D, weight-bearing exercises like resistance bands, and a calcium-rich diet with foods such as sardines and leafy greens. A year later, she was back performing on the piano with stronger legs, improved balance, and 0 fractures. A quick scan may seem like a smart move, but for people over 70 who aren't falling or breaking bones, the better approach is lifestyle. Strength training, balance exercises, proper nutrition, and correcting vitamin D deficiency have been shown to reduce fractures by over 20%, according to a 2022 Osteoporosis International study. Don't let a number on a screen scare you into treatments you may not need. But there's one scan that can lead to something even scarier: brain surgery. Let's talk about that next. Number 4. Brain MRI for memory loss. When seniors notice they're becoming more forgetful or confused, the natural reaction is fear. Fear of dementia, fear of Alzheimer's. Doctors often respond by ordering a brain MRI. Here's the uncomfortable truth. MRIs, detailed scans showing the structure of the brain, rarely give the answers patients hope for. In most people over 70, MRIs simply reveal age-related changes, like slight shrinkage or white matter spots, which are completely normal. But here's the catch. Once those spots are found, they can trigger a cascade of fear, additional tests, and even surgery. Surgery that may not improve memory and can sometimes make things worse. In 2021, a study published in Neurology Today reviewed over 3,000 MRI scans of patients aged 70 to 85 with mild cognitive complaints. 86% showed some form of brain abnormality, but only 3% of those findings were linked to a treatable condition. That means 97% of people experienced the emotional toll of thinking something was wrong when really it wasn't. Worse, nearly 12% were referred for invasive procedures like spinal taps or exploratory biopsies, all based on vague scan results. Take George, a 74-year-old retired engineer. He was worried about forgetfulness. He was mentally sharp, but misplaced keys more often and occasionally forgot names. His doctor sent him for an MRI, which showed white matter changes. He panicked, convinced he had dementia, and stopped driving and attending church. Over the next few months, his anxiety worsened. But when we reassessed him with a standard cognitive test, his score was well within the normal range. We explained to George that those MRI findings were completely normal for his age. We guided him toward lifestyle changes, like better sleep, hydration, and brain exercises. Within 3 months, his memory stabilized and he felt like himself again. The truth is, unless there are severe neurological symptoms like seizures, sudden personality changes, or rapid functional decline, an MRI is rarely necessary for mild memory loss. A smarter first step is a cognitive screening test, a simple paper-based exam that assesses memory, attention, and problem solving. It's inexpensive, effective, and avoids unnecessary anxiety. Now, get ready. The next test on this list is one you've probably undergone multiple times, and it's number 3 for a reason.
Number 3. Cardiac stress test. It's one of the most common tests given to seniors complaining of mild fatigue, chest tightness, or simply feeling off. The cardiac stress test monitors your heart while walking on a treadmill or receiving medication that simulates exercise, and it's designed to detect blocked arteries. But after 70, this test can often do more harm than good, especially in people without clear signs of heart disease. That's because it frequently triggers false alarms and leads to unnecessary heart procedures, which carry serious risks. The issue is accuracy. Studies show that in adults over 70, the false positive rate for stress tests, meaning the test indicates a problem that isn't really there, can reach 40%. This often leads to follow-up procedures like angiograms and sometimes unnecessary stent placement or bypass surgery. In 2017, a major study in JAMA Cardiology found that more than half of stents placed after stress test referrals were in patients who had no real symptoms and received no actual benefit. These patients saw no improvement in survival or quality of life. What they did experience were higher rates of bleeding, kidney injury from contrast dyes, and longer hospital stays. This happened to Raymond, a 75-year-old retired postman who stayed active by walking daily. During a checkup, he mentioned he sometimes felt tired climbing hills. His doctor scheduled a stress test just to be safe. The results were unclear, so he was sent for a catheterization, a procedure where a tube is inserted into the arteries to check for blockages. A mild narrowing was discovered and a stent was placed. But that same night, Raymond had a reaction to the contrast dye and developed kidney problems. He spent 6 days in the hospital and needed weeks of follow-up care. His fatigue never improved because it wasn't a heart issue at all. He was simply an older man who needed better hydration and more rest between meals. If you're over 70 and not experiencing classic cardiac symptoms like chest pain during activity, shortness of breath with exertion, or a significant drop in energy during light exercise, a stress test may do more harm than good. A safer alternative is often a resting EKG, which looks at the heart's rhythm while you're still, or even a coronary calcium scan, a low-radiation imaging test that shows whether dangerous plaque is building up. These tests are simpler, safer, and far less likely to push you into unnecessary procedures. Number 2. Colonoscopy. You might not have expected this one, but colonoscopy, a procedure using a long camera to inspect the colon, is not always a wise choice after age 70 and is almost never recommended after 75 unless specific symptoms are present. The risks rise with age. Preparation is harsh, involving strong laxatives that can cause dehydration, dizziness, or kidney problems. Sedation during the procedure adds additional risks to brain function in older adults. Perhaps most surprisingly, the procedure itself can cause complications, including bleeding, tearing, or even heart rhythm disturbances during sedation. A 2019 study in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older. They found that for every 1,000 colonoscopies done in patients over 75, only 2 lives were saved, while over 20 people experienced serious complications. That's a 10-to-1 risk to benefit ratio. Even when polyps are found, many are small and slow growing. Removing them in older adults can sometimes do more harm than leaving them alone. Take Dana, a 73-year-old grandmother who ran a small bakery with her daughter.
She had no symptoms, no bleeding, no changes in stool, and no family history of colon cancer. But her new primary doctor, fresh out of residency, urged her to have a screening colonoscopy. She agreed. During the procedure, a small polyp was removed and she was sent home. That night, she experienced intense abdominal pain and fainted. At the hospital, doctors discovered a bowel perforation. She spent 9 days recovering, lost 10 pounds, and hasn't been the same since. When we reviewed her case, we found she had already undergone 2 clean colonoscopies in the past. There was no reason to repeat the procedure. The U.S. Preventative Services Task Force currently recommends stopping routine colon cancer screening at 75 for most people. For those in excellent health, a stool-based test, like the FIT test, which is a non-invasive fecal test done at home, is often a safer alternative. It requires no prep, no sedation, and still detects most concerning cases. Ask your doctor about alternatives. Once you're in the colonoscopy pipeline, it's hard to get out. And now we've reached the most overused, most dangerous, and most harmful checkup for seniors, one you've almost certainly had.
Annual full-body CT scans. Full-body CT scans, sometimes offered as part of executive health packages or as preventative services in private clinics, are marketed as a way to detect cancer early. But here's the shocking truth. These scans expose your body to high doses of ionizing radiation. For older adults, especially those over 70, the risk of triggering unnecessary follow-ups, biopsies, and even surgeries is extremely high. And the irony? There is zero evidence that full-body scans in people without symptoms actually save lives. Each scan delivers between 10 to 20 millisieverts of radiation, roughly equal to 500 chest X-rays. A 2023 modeling study published in JAMA Internal Medicine found that the rise in CT scans across the U.S. may now be responsible for up to 5% of all cancers, putting them on par with alcohol as a cancer-causing factor. That means 1 out of every 20 cancers could be caused by a scan that was supposed to prevent disease. That's not just counterproductive, it's terrifying. CT scans can detect harmless nodules, calcifications, or cysts that are simply part of normal aging. But the moment they are spotted, a red flag goes up. More scans follow, then biopsies, then panic. Take Marcus, an active 80-year-old who used to teach martial arts to younger seniors. Sometimes these tests leave you worse off than where you started. So there you have it, 5 checkups that may seem helpful but can actually harm, especially once you're past 70. Modern medicine is powerful, but it's not perfect. Sometimes less is more. Always ask yourself, what happens next? If a test finds something, if the answer is unclear, or if the risks outweigh the benefits, it may be time to pause. And remember, real prevention starts with lifestyle. Stay active, eat well, sleep deeply, and choose your checkups wisely. Now, we want to hear from you. Have you or someone you love ever faced complications from a medical test or treatment that turned out to be unnecessary? What happened? Share your experiences and thoughts in the comments below. We'd love to hear them. Thanks for watching.